I'd like to thank you for joining us today for not one but two very important announcements. First, on behalf of President LaRiviere, I'm happy to announce that the University of Oregon will officially kick the habit in fall of 2012 and become smoke and tobacco free. By going tobacco free, we hope to reduce the risks of secondhand smoke exposure and to ensure a healthier environment for our students, faculty, staff, and visitors. In the next few weeks, we'll appoint an implementation committee that will make policy recommendations to the President. In addition, the U of O will provide our students, faculty, and staff with cessation support, including free nicotine replacement products and cessation counseling during this interim period.
Today we're choosing the health of all over the convenience of some, and accessibility over the ease of inaction. We are joining the hundreds of campuses all over the country that have gone smoke-free and tobacco-free and have never looked back.
You're helping set that standard to make sure that just like in airplanes and restaurants, we don't have to worry about being in buildings or even walking across campus and being exposed to someone else's secondhand smoke.
PacificSource is an independent, not-for-profit community health plan based in Eugene that serves the people and employers of the Pacific Northwest. We are pleased today to announce their $1 million gift to the University of Oregon. Through this gift, they will partner with us to help fund wellness research and promote exercise, healthy nutrition, and tobacco cessation as part of the Healthy Campus Initiative.
As we move forward, the new director of the Healthy Campus Initiative, Campus Human Resources, the University Health Center staff, and our peer health educators will work together during the transition period to provide education, prevention, and cessation support to our students, faculty, and staff, the entire community.
It's really, our goals here are to make this an educational opportunity and a supportive environment to help the many smoking students that would like to quit and staff and faculty. It's not really aimed at enforcement as a primary tool. It's really rather have support and education as the primary tools. It means they'll have a cleaner air environment to do their work. I mean, you look at the Duck football team and all of the accolades they're getting for conditioning and the speed that they work. They couldn't do that if they were smoking. And all of us will be more effective if we're in a cleaner air environment. And so it should be a benefit to the entire community. It's really a statement of the culture that we want in this community, that we're building towards clean air and a healthy environment. And if you've got pockets that are smoke-free and smoked, then you start talking about the boundary lines and how close you can be to a building and those kinds of things. We would just like to as a community, make the value statement that we want health and clean air to be important to us in the entire community.
You know, as a company, we have a smoke-free campus. Of course, we don't have residential life, so it's a little easier to do. We believe it's one of the cornerstones of developing a focus on wellness and prevention, as well as physical activity and healthy eating. So I'm not a research expert, but I do know there is good evidence that smoking in the outdoors even creates some environmental issues. I think more importantly, it's a cultural issue that creates a healthier environment for the university.
I think this policy change definitely makes U of O a role model. We're the first school in the Pac-10. We beat OSU, who's been talking about this for a while as well, which is really exciting. And I think it does. I think there's a spotlight on U of O right now, and I'm really excited that we can use that spotlight for something that's good and is a really positive health initiative. I know that health center staff are really committed to having students involved in that process, so we have great student leadership committees, the Student Health Advisory Committee, peer health educators, and so students who are really committed to health will be able to be very actively involved in implementing that policy, and then that's the way it should be, because we really want to have peers enforcing this policy to each other, and that's going to be way more effective in the long run. I think the exciting thing about this policy is that it's really a collaboration between the university administration and students, and that's something that I'm really proud of, because it means it'll be a lasting legacy that everyone can agree that this is the right thing to do moving forward, and that's really exciting.